Welcome back to Daybreak. Well, if you are diabetic or you have someone in your family who is, the Diabetes Education Center is here in Cayman, and it's right near in Georgetown. And Mr. Todd Jefferson, who is a clinical pharmacist, he's going to tell us all about what they do here and why it is important for people to come.
Good morning, Delicia. Good morning, everyone. This is the first Diabetes Education Center within the Caribbean that was set up. We're modeling the American Diabetes Association's program for diabetes education. And there are a lot of diabetes resource persons on the island right now. And we're focusing on teaching patients more about their condition. It's a chronic condition that needs to be actively managed so that their disease is under control as best as possible to reduce their risk factors for stroke, heart attack. We heard it all before: stroke, heart attack, blindness, amputation, and kidney failure. So we want to make sure that these patients have the tools in which to reduce their risk for these long-term illnesses and to better control, have a good quality of life as they pursue their normal daily activities.
Now, what would people who or patients that come here, what would they be getting?
We talk about 4 key areas. We talk about monitoring their glucose daily, and we also talk about good doctor visits, what they should ask from their doctor, what should they have checked out. We talk about meal planning and carbohydrate counting, and then we talk about activity, getting physically active. If they have a medical condition which limits activity, we always say go to your doctor first, but try walking if that's an option for you. If you're not sure about levels of activity, then talk to your doctor. And then we talk about taking your medicines, and we teach them how to take the medicine correctly, when to take it, and what side effects that they may experience, and how they can reduce the likelihood of this side effect.
Approximately how many patients do you have coming here to the Diabetes Education Center?
We've had, as of now, our last 6 months, we've had 100 patients, and that's still climbing. We're getting referrals in from doctors, and we have our own clients who have visits before are referring their family members and friends. So we still have many people coming to the Diabetes Center. In addition to that, we have a diabetes support group that meets every 3rd Wednesday of the month, but this January we're having on the 4th Wednesday, the 25th of January at 7 p.m. We're going to have a nutritionist, a dietitian come in and talk to our members about nutrition after the holidays to get them back on track, and so that they will go back into the habits of, remind them more so about carb counting and watching what they're eating. They can eat anything they want to eat, but it's the portion control that we're interested in, and that's why we thought our dietitian would be the best healthcare professional to meet their needs at this time.
So definitely people out there who are diabetic or have a family member who is, should take advantage of it and come on down here at the Diabetes Education Center.
Of course, yes ma'am.
Now, exactly, kind of, when you say portion control, what exactly is there? Or how do you do that?
A lot of people, when they go and they have a drink, they have no concept of how many portions are within that drink, or if there are any carbs in it or any carbohydrates. So we teach them. We just pick up something like this and we say, ma'am, this is a glass of milk. And so this would be 1 portion of 1%, 2% of skim milk, and that's 1 serving of carbs. We teach them in the medical nutrition or meal planning for diabetes, what is a portion of carbs, and based on their weight and height and their BMI, we would teach them how many carbs they would need throughout the day. Some patients want to lose weight at that point, so we try to cut back down. We do the basic nutrition, and then they can also go on to a dietitian if they wish to later on. They can do it jointly as well, of course.
And just to wrap it up now, what is the importance of coming here and ensuring that you're, I guess, more aware as to what?
We want to empower the patient to take care of themselves and to actively manage the disease. It's a long-term chronic condition, so we want to make sure if you have the tools, you'll know how your body's feeling, and you know whether or not you should go to your doctor if something's going wrong, and you also know if you're testing your glucose, everything's going smoothly. You adjust day to day to what's happening in your life. We're all active, we're all constantly moving each day in and day out. So we need to know that we need to be flexible with our diet and flexible with how we're managing our disease, but at the same time we want to keep on track. We're trying to keep everything smooth, and so we empower the patient to make positive changes in their life.
And one last question before we go: what if you have kind of your family has a history of diabetes? Should you come as well?
We would say if you have a family history of diabetes, go to your clinician and have testing done. We ask them to do the A1C test to have their glucose tested, and at that point they will know whether or not they are pre-diabetes, whether or not they're showing signs that they are starting to have glucose intolerance or having problems with their sugar level control. And so I'll give them just as a wake-up call, something's going wrong at the moment, let me go to my doctors and see if something needs to be adjusted so that I can prevent the onset of diabetes.
And of course, these support groups are free of charge.
That's correct.
All right, and once again, just to wrap it up now, let them know what date they can come down.
This month is the 25th of January at 7 p.m., but it's normally the third Wednesday of every month. We try to bring in a different clinician. We have different topics. The diabetes support group members will choose the topic that they wish to talk about the following session. Okay. So they're in control. It's all about their own support, and they're supporting each other. They're telling their stories, telling their experience, what works for them, what didn't work, so that they will pass on their knowledge to other group members.
All right, thank you very much, Todd.
You're welcome.
All right, viewers out there, be sure to take advantage of Caribbean's first diabetes education center here in Cayman, just in front of Chrissy Tomlinson Memorial Hospital. That's it for Daybreak right now. We'll be more after the break.